Hi, everybody. Welcome back to another episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer, and I work for the Neurologic Wellness Institute. And today the topic is going to be, what is Tourette syndrome? And Tourette syndrome is a hyperkinetic movement disorder, meaning there's too much movement, that generally starts in early childhood. And most people or most children will outgrow it, but it does persist into adulthood in about a third of the people. And Tourette syndrome, being this hyperkinetic disorder, there are these involuntary movements or vocalizations that occur. And so it could be a tic movement in the eyes, face, nose, arm, neck. And these are these urges where the person feels it coming on and they can't really suppress it. They suppress it, it's just going to, this urge is going to keep going, and then they just let it happen. Another factor could be like the vocalizations. Vocalizations could be excessively clearing the throat, could be saying profanity or any other word, phrase that could be very common. If it's profanity, it's called coprolalia, basically meaning that that person is constantly shouting out profanity. Okay, so different swear words. And so I want to talk a little bit today about what is Tourette syndrome and why does it occur, what is the dysfunction going on in the brain, and then how do we try to decrease the patient's symptoms. Because Tourette syndrome isn't generally just a syndrome on its own. These kids generally have other factors going on as well, whether it's ADHD or adverse childhood experiences, something like that. So we're going to talk about two papers. The first one we'll talk mostly about. The second one is mostly just being used for a picture, but I like them both. So here the first one is. It's from May 2014. Imaging the where and when of tic generation and resting state networks in adult Tourette syndrome. So these were taking all adults, and they were looking at basically where does the tic generate from, and then when does it generate, like how early does that generate in the brain, and then therefore we can look at how we can activate different regions to fix it. And so looking at the abstract, Tourette syndrome is a neuropsychiatric disorder with the core phenomenon of tics, which origin and temporal pattern are unclear. Okay, and so they looked at different methods. Their results were that basically 2 seconds before a tic occurred, there were different areas that would fire. Okay, and this was done using an fMRI session where the patient just laid in there for, it was like 60 to 90 minutes, depending on how much they could handle, and let their tics just happen. So 2 seconds before the tic, the supplementary motor area, ventral primary motor cortex, primary sensory motor cortex, parietal or operculum, all activated. I'm going to show a picture of this here in a sec. 1 second before, there were some other areas that were a little more primitive. So 2 seconds is more in the cortex, 1 second, some areas in the cortex, but also deeper. And then at the tic onset, had again deeper areas along with back to the cortical areas, the primary motor, the somatosensory areas. And so basically they demonstrated that the temporal pattern of tic generation follows the cortico-striato-thalamo-cortical circuit, basically a connection that goes from the cortex deep into the brain, through the brain, and coming back out to then generate this tic generation. So real quick, I just want to talk about the basics of Tourette syndrome. And so it could be multiple motor or vocal phonic tics. Okay, it typically begins between the ages of 4 and 6, and then up to 60 to 70% of patients, the tics subside in adulthood, leaving about a third of the patients having chronic adult Tourette syndrome. And so Tourette syndrome is often accompanied by obsessive compulsive disorder, attention deficit hyperactivity disorder. So these are all comorbidities that will occur. And this is all, both of these conditions have problems with development in the cortex of the brain, that also lead into the basal ganglia, or the deep parts of the brain. And so that's kind of what this is talking about. The pathophysiology of Tourette syndrome is this cortico-striato-thalamo-cortical circuit. And there's basically frontal areas, basal ganglia, insula, and the cerebellum in the back. And it's this failure of maturation of the circuit, this failure to develop and perform properly. And that's what leads to the Tourette syndrome symptoms. So, what I like about this article is they used an fMRI study, or was an fMRI study. And so you generate some pretty cool photographs, even though this may mean nothing to many of you. I just liked how at 2 seconds before the tick, you can see these different areas lighting up. The supplementary motor area, the primary motor cortex, a little more of the sensory motor strip. Right there's more of the primary motor. And so I just think that's kind of cool. You can see the parietal operculum they talked about. 1 second before is deeper areas in the anterior cingulate cortex or gyrus, the insula deeper, some of the temporal and occipital areas, but then also deeper like the putamen or other areas in the basal ganglia. And then on tick onset, you basically have the thalamus, which is this relay center, but then also we're going back into that primary motor cortex, which right here is actually that face distribution. So a lot of times ticks are in the face, and so this is where that facial distribution is. So it makes sense that this would be active at the onset of the tick. Okay. So then let's go to this paper. So this paper is from March of 2019. Okay. And they're looking at sensory motor interactions underlying the symptoms of Tourette syndrome. So this picture is a lot better for me to kind of describe and talk about things. And so we have this tick generation and expression, what is active, this premonitory phenomenon. So basically what's active at the beginning, the urge of the tick, and then the tick suppression. So when children or adults try to suppress the tick, they're using other areas that are more in this frontal region to suppress it, but it doesn't always work. And generally the tick will just have to come out. So with the tick genesis and expression, so the formation of the tick and the actual the expression of it, we're getting a lot of this motor cortex, sensory motor area, and the premotor cortex, along with the supplementary motor area. They talk about putamen, globus pallidus. So this is that cortico-striato-thalamo-cortical loop, okay, going through here. And so what's cool about this is we know that if the tick is more, let's say on the left side or the right side, we can say that this area is overactive. The neurons aren't as stable there. And so we may need to dampen that by working on the other side. The phenomenon of the actual urge for it starts more in the sensory area and less in that premotor supplementary motor area. Okay, and then tick suppression, we're using these higher frontal areas, this inferior frontal gyrus, orbital frontal area, the pre-supplementary motor area, and the subthalamic nucleus is important in inhibiting movements, or it's the indirect pathway that is involved in basically stopping movements. And so this is where this is involved. And so tick suppression is this conscious trying to suppress this urge to have a tick, right? But sometimes these pathways are still too powerful. And so therefore the tick suppression can only last for so long. Okay, so what do? We look at each of these areas through different eye movements, whether the eye movements are with different head tilts or in the dark. Are they eye movements where you're following a dot, or you're just watching the dot move side to side or up and down? And that allows us to get a good picture of, one, what side of the brain is overactive. Two, is that side of the brain overactive more inherently, or is there something else underlying this overactivity? And so what we can do then is we we work to fix those objective findings, those eye movements, at the same time trying to prevent activation of the area that is causing this tic generation. And if we can do that, we can do a good job of lessening that tic expression. Okay. At the same time, there are other dietary factors, lifestyle factors. Stress can produce more tics. Lack of oxygen, because some of these deeper areas in the brain need oxygen, and every part of the brain needs oxygen, but the deeper part has smaller blood vessels, and so they have generally a less oxygen delivery. So things like a hyperbaric oxygen chamber can work really well, but also diet and exercise. So making sure that we don't have an anemia, making sure we're getting enough nutrients to get blood flow there, exercise to get blood flow to the brain can all be beneficial, and then reducing stress. Having a good diet where we don't have a lot of inflammation can also be beneficial. So I hope you guys enjoyed this one. Tourette syndrome is something that can be very debilitating to many people. First in childhood, growing up, being teased a lot, but then also in adulthood when there is other things that may need to be done, like work, taking care of kids, and the tics, and especially vocal tic, can be very disturbing and very cumbersome for people. So if you have any questions or comments, please leave them below. Thanks again, and have a good day. Stay healthy.